This morning on today's Healthy Heart, what women should know about heart disease. It is the leading cause of death for women, with 1 in 3 dying of a heart-related illness. Dr. Keri Peterson is a contributor to Women's Health magazine. Keri, good morning.
Good morning,
We can't
Natalie.
overstress this enough because women tend to overlook or ignore a lot of times the symptoms of heart disease. What kinds of health problems are women dealing with when you talk about heart disease specifically? I know you've got that model of the heart right there.
Yes, so there's a number of conditions that are referred to as heart disease. There's heart failure, there's arrhythmias, and the most common disease, coronary artery disease, which I'm going to explain. It is a development of plaque in the arteries of the heart, and when the arteries, as you see, supply the muscle of the heart, when they become blocked and completely clogged, the heart muscle loses oxygen, the tissue dies, and that's called a heart attack.
And women, as I mentioned, often experience different symptoms than men. So therefore, they tend to overlook. According to the American Heart Association, about 50% of women don't even call 911, according to a survey last year, because they don't think that they're having a heart attack. What are some of the specific indicators that we should be looking out for?
Well, there are differences between men and women with regards to heart disease. The first, as you mentioned, is that there can be very different symptoms between men and women. And the second is that women have smaller hearts than men. The heart is about the size of your fist, and the vessels in a woman's heart are smaller in caliber than a man's heart. So it takes less blockage to clog them off than it does for a man. And in addition, for women, we get heart disease later in life than men. We typically have a significant rise in the incidence of heart disease after menopause. So there is some protective effect premenopausally. So this encompasses the differences between the genders.
Between men and women. Okay, so and then when it comes to the actual symptoms, I mean, some of them are, for the most part, what you would expect. The chest pain, that is something, you know, that is a real indicator.
That's correct. So chest pain, which is that tight squeezing sensation, really
or the burning.
Yes, it really only occurs in 30% of women. Instead, women tend to get other variations of symptoms. They'll get nausea, shortness of breath, fatigue, weakness, sweats, dizziness. So it's important for women to recognize these symptoms and seek attention if they experience them.
And what are some of the risk factors for heart disease, particularly for women?
So there's several that people may be familiar with. There is high blood pressure, high cholesterol, obesity, family history, diabetes, and smoking, but a lesser known risk factor is secondhand smoke, which is a relatively new discovery that secondhand smoke exposure can also cause heart disease, and it causes 46,000 deaths per year in non-smokers. So something new to be aware of.
And when it comes to your health, there are 4 numbers that you should pay particularly close attention to assess your heart disease risk as well. And that first being is your cholesterol.
Yes.
So what's the number that you should know?
Yes, at Women's Health, we have 4 numbers to know. The first one is for your cholesterol, you want to know that number, and the LDL should be below 130. The next number to know is your blood pressure, and the ideal is 120/80. Third number to know is your body mass index. That's a ratio of your height and weight, and that should be somewhere between 18.5 and 25.
Okay.
And lastly, you should know your blood sugar level, and a fasting blood sugar should be below 100.
Now, some of the things that you can do then to control some of these numbers and help reduce your risk factors, obviously behavior when it comes to quitting smoking and the things that you need to be taken care of, right?
Yes, quitting smoking is the most important thing you can do for your health to prevent heart disease. And in addition, common sense things, diet and exercise. And in particular, when it comes to diet, you're going to address the specific targets of your problem. So if you have high cholesterol, you're going to want to attack your diet with low saturated fat. If you have diabetes, you're going to want to approach it with a low carbohydrate diet. And if you have high blood pressure, you're going to want a low sodium diet. So you really have to tailor it to your risk factors. And then above all, you want to maintain a healthy weight. That means exercising regularly, and that will modify all of your risk factors.
And I think what is startling to a lot of us is, I mean, women, we tend to take care of everybody else, and when it comes to taking care of us, we don't look after ourselves. And so when you talk about these numbers, that women are ignoring these symptoms, and that's why 1 in 3 are dying of heart attacks. You have to pay attention. In fact, the Health and Human Services campaign launching today is called Make the Call, Don't Miss a Beat. They're saying make sure you call 911 if you're feeling any of these symptoms. And You're wearing your red proudly.
Yes,
so.
I am. This Friday is National Wear Red Day. It is just a statement for women to create awareness about heart disease education, because that's where it really starts.
All right. Well, Dr. Keri Peterson, great information as always.
Thank you
so much. And much more on our website, by the way, as well, to spot the symptoms on heart disease.